Free audio post-production by alphonic.com.
There have been so many misconceptions about fibroid, or when it comes to fibroid, there are lots of things that people say that are not true. Okay, and today we are going to break all those myths. We are going to talk about what exactly fibroid is. We are going to talk about who is at risk of getting fibroid. How do you tend to know whether you have fibroid? What are the treatment options for fibroid? We are going to say every single thing about fibroid. So what I need you to do right now is get your pen and your paper ready. Let's start talking. Now let's start from the beginning. Fibroids are also called uterine fibroids, okay? And then these things are non-cancerous. The first myth, fibroid is never a cancer. Fibroids are non-cancerous. There are a lot of people that when they hear the word fibroid, first thing that comes into their head is cancer. Now, let me tell you what cancer is. Cancer is an abnormal growth, okay, of a particular part of your body that can spread from one place to the other. Now, fibroids develop in a woman's uterus, which is the womb, okay? They are found in women that their age ranges between 20 to 45. Now, I'm going to tell you the reason why fibroid ranges between the ages of 20 to 25. Fibroid depends on something we call estrogen. As the video goes on, I'm going to explain that to you. And interestingly, women have fibroid and don't even know that they have them because sometimes there are no symptoms at all. Now, what are fibroids? Okay, now fibroids are basically a lump that contains muscles and then fibrous tissues. That is what fibroids are. That's why I was telling you that fibroids are non-cancerous. And then in most cases, fibroids don't tend to cancer or fibroids don't become cancer. Now listen, some women can have just one fibroid and other women can have multiple fibroids, okay? And then some women can have very small fibroids and other women can have a big fibroid. Fibroid can be as small as a castor seed, the one that Jesus said that let your faith be as strong as a castor seed, that one. And then other women's own can be as large as the size of a watermelon. Okay, so we have it in different shapes. So depending on the size of your own, the shape of your own, and how it's affecting you, that's how your treatment comes about. Now, I mentioned earlier on that you can have fibroid and then that fibroid will not be showing any symptom in you. That is another case that we're going to talk about. I hope you are writing your notes. Very good. Now let's continue and let's talk about where fibroids develop. Now, fibroids develop in the uterus, okay? Fibroid can develop inside the uterus itself. It can develop in between the muscles of the uterus and it can develop outside the uterus, exactly outside the uterus, okay? So if this is the uterus, it can develop inside the uterus. It can develop on the uterus, okay? On the uterus, and it can develop outside the uterus. I hope you get me. Good. Now, depending on where the fibroid has grown, that can show different symptoms. If the fibroid grows inside, another case. If it grows in between the muscles, another case. If it grows outside the muscles, another case. Now, somebody's concern right now is what are some of the signs that they are going to see to know that they have fibroid. Now, this is it. In some women, it doesn't show any sign at all. You won't see anything. But for other women, fibroid can cause heavy bleeding, periods that last more than 7 days, painful period, lower abdominal pain, or you have pain inside your pelvic area, frequent urination, constipation, pain during sex, difficulty getting pregnant in some cases, and sometimes it can lead to miscarriages, especially if the fibroid is very big or it is badly positioned. Now, I'm going to make a video that talks about why fibroids can cause miscarriages. So if you want to get that, subscribe to the channel. If you're watching us on TikTok, follow us, put us on post notifications so that when we drop that, you can lay your hands on that or you can grab a copy of that. All right, so let's continue. Now, I know there are lots of questions running through your head right now that you want to ask me. And one of them is including that, what shows that I can get fibroid? What are the things that prove that somebody can get fibroid? Now, this is it. If you are 20 to 45 years, you can get fibroid. That is one factor. It doesn't mean that if you are 20 to 25 years, you will have fibroid. It means that you can get fibroid, okay? If you are somebody that your family, your sister, your mother, your closest relative, so one person has fibroid, it means that there are higher chances that you can also get fibroid, okay? Another thing is if you're a black woman or an African woman, you can get fibroid. Women that have their menses at very early stage, those women are at higher chances of getting fibroid as well. Now, you are wondering what at all causes this fibroid that they've been talking about. Now, listen, the exact cause is not known. Even doctors don't know exactly what causes fibroid. But fibroids are strongly linked to hormones, especially estrogen and progesterone, as well as genetics. Okay, so genetics also play a part. So if you have it in your family, you have higher chances of getting it. Now, let me prove to you the reason why hormones play a part in causing fibroid. Now, look at this. If you're a woman that your age range from age 20 to 45, we said that you had higher chances of getting fibroid, isn't that it? Now, it is at that age that estrogen levels peak inside your body. So when estrogen levels peak inside your body, fibroids feed on the estrogen, okay? That is why you see that man who has fibroid but has gotten to menopause age or 50 years and above, those women, the fibroid starts shrinking. So at that age, you see that the fibroid has started shrinking. It has started reducing in size. That is the proof that fibroids are linked to hormones, okay? Another factor is genetics. Genetics also play a very big role in who is at higher chances of getting fibroid. If you have a family member who has fibroid, you're also at higher chances of getting fibroid. So you need to take a very, very good care of yourself. You need to be examining yourself. You need to pay attention to it if you have a family relative who has fibroid. If I'm telling you to go check out to see whether you have fibroid, how are they diagnosed? Now, doctors can detect if you have fibroid using pelvic examination. So they can use their hand to palpate your pelvic area, and then they will tend to feel the lump, okay? If it is very small, they need to do ultrasound scan, okay? They can even do MRI to detect how big or small, how detailed the thing is, so that they can know the exact treatment that they are going to put you on. Now, speaking about treatment, let's talk about the treatment options, because many people get worried when it comes to fibroid treatment. Now, fibroid treatment depends on the size, as I've said earlier on. So fibroid treatment depends on the size of the fibroid, the symptoms that the woman is showing, and then whether a woman wants to have children in the future. One of the most common treatment that they do is what we call watchful waiting, and that is no treatment at all. All they are going to do is that they will sit down and then they will tend to monitor the fibroid. They will tend to monitor the growth of the fibroid, okay? And if it is becoming unbecoming and is causing trouble for the patient, then we need to move on to the next step. That is medication options. Now, most of the time, the medication options are given to women to shrink the fibroid for a temporal period, okay? And then for when that temporal period comes, then they are going to move the patient to the surgery, and then they are going to do the surgery for the woman and then take the fibroid out from that place. Now, this is it. The best treatment for fibroid is surgery, okay? And then that is the last option. So if they do watchful waiting, it is not resolving. They give them medication, it's not resolving. The next thing they are going to do is to do surgery, okay? They do the surgery and then they remove the fibroid. That surgery is called myomectomy. Now, in cases where the woman has done a myomectomy, it come back again. They do another one, it come back again. They do another one. Yes, this thing is true. You can do a fibroid surgery and then need to come back again. It is very, very true. So you can do it, it come back. You do it, it come back. If they discuss with you and you agree that you don't want to give birth anymore, you don't want to have a child, then they are going to remove your womb totally, and that surgery is what we call hysterectomy. Now, there is one last treatment that they can give you, and this is new, okay? Somebody shouts technology. Now, this is the option that they go into the woman's womb using cameras and then some machines. Then what they are doing is that they are going to cut the blood supply that supplies the fibroid, okay? They will cut the blood supply, or the blood vessel that is supplying it, they will cut it. So if there is no nutrient, there is no oxygen coming to the fibroid, what's going to happen is that it will shrink and then it will die off. Yes. So that is the latest option that they are using right now. And then it depends on technology. So depending on the technology level of your country, then they are going to do that for you. I hope you are writing your notes. Very good. So finally, let's talk about lifestyle changes, okay? Now, lifestyle changes cannot completely prevent fibroid, but they may help reduce the risk or support your overall health when it comes to fibroid health. Your lifestyle changes, it doesn't take away the fact that you won't get it, but it can help support your overall health, okay? Now, the first thing on lifestyle changes list is that maintaining a healthy weight is very, very important. It means that eating more fruits, eating more vegetables are going to help you, okay? Reducing red meat can also be beneficial. Regular exercise is also good. And then managing stress and hormonal balances are also important. All those are important matters. So that is it basically today. That's a full breakdown about fibroid, what fibroid itself is, what causes it, how it comes about, who is at risk of getting it. Now you know everything about fibroid. Now all those misconceptions that they keep telling you, I know now you're going to deal away with them. Okay? And yeah, fibroids are not cancer. I need you people to get that thing off your head. Fibroids are not cancerous, okay? That is it basically. My name is Mr. Madugu. Don't forget to subscribe to the channel. If you're watching us on YouTube, subscribe to the channel. If you're watching us on TikTok, don't forget to hit that follow button so that we keep seeing each other around. If you want to get more information like this, and yes, you can be a good Samaritan and share this video to that friend that needs to hear it. See you around, stay healthy, and stay safe. Peace.
Free audio post production by alphonic.com.